maybe HR facilities had some challenges in adapting to the public health crisis and the pandemic, and also supply chain disruptions, which I know that we experienced a lot, particularly in the beginning of the pandemic. So that was definitely a challenge for many of the researchers. Nicely, there were most of the aspects that we asked about were more leaning towards being facilitating. So, for instance, research prioritization. So, and we know that the societies, the universities really focused and tried to prioritize efforts fighting the pandemic. So that is something that we're facilitating the research project. Funding availability as well. So a lot of new funding were made available. Remote collaboration was important. Increased demand for specific research. I guess this a little bit goes hand in hand with research prioritization and funding availability. Public interest and engagement also helped. The fact that we did have digital infrastructure and platforms like what we're using now, Zoom, was important. It seems like most of us went through a crash course in how to work in digital environments in different ways. So that was definitely facilitating as well, that was available. Previous knowledge on the topic was important, so kind of reflecting the fact that most of the researchers did have a background in pandemic-related research. Public healthcare academia relationships were also facilitating, so that was important to have that in place in order to act swiftly on this. And then we asked another question. In your opinion, how much would the following items ease conducting a future research project during pandemic? So with the lessons learned or their experiences from the pandemic, what are the researchers' view on the most important items or things to focus on for a future global health crisis? So there were some definitely challenging and some not challenging or facilitating, but I have decided to focus on the ones that are needed to put in place to be facilitating for this presentation. So what they say is the digital infrastructure is important, availability of time important, flexible funding important, previous knowledge on the topic is important, private business academia relationships important, streamlined regulatory processes, very important, public healthcare academia relationships also important. So both public healthcare and private business are important to collaborate from an academic perspective. It is important to have adaptable lab protocols in place, the global collaboration, public engagement, and availability of research infrastructure. Some of these connect very well to what they found facilitating also when they performed the current research project, but it also seems that there is a potential to develop these further. And there are also some new points coming up here. And the researchers really stress the importance of global collaboration and availability of research infrastructure, which I think is particularly relevant for EUGLOHRIA and EUGLO, and really showcase the importance of having well-established university alliances to facilitate a swift response against global health crisis. So finally, on the survey, was your research project translational? And there seems to be a more or less 50-50 response of that. And when we asked them more specifically on the main areas of translational research projects in the survey, what they stated was that public health and healthcare organization, diagnostics and biomarker evaluation, clinical and preclinical studies. So that's very classic kind of translational collaborative aspect in medicine. therapy and treatment methods, vaccine and drug development, medicine and personalized medicine, biomedical and disease-specific studies, technology and device development, immunology, virology, infectious diseases, cardiovascular and thrombosis research. So, and we know also from, in particular for this pandemic, that there were a lot of focus on cardiovascular and thrombosis research, in particular in the beginning, where we try to understand on how to best treat individuals with severe COVID-19. Interestingly, we also asked about the main recommendations for university leadership and politicians that the researchers would like to provide. And some of the main recommendations were cooperation and infrastructure. So we need to strengthen that further. Again, supporting initiatives like the EUGLOHRIA Alliance and EUGLO Alliance. Transparency and evaluation. Funding strategy. Research and innovation. Emphasizing interdisciplinary basic research. Here, I think also this aligns well with the work that we've been doing in EUGLOHRIA. And here, if you're particularly interested in focusing on interdisciplinary research, I think that the model that we developed based on the hierarchical clustering could be very useful to speed up this process and identifying potential interdisciplinary new research collaborations. And then data and protocols is also very important to simplify how to protect the data and also make some of the data publicly available. So, moving forward. So as I mentioned in the beginning, the whole purpose of my presentation here was really to provide you with a background on the work that we've been doing within EUGLOHRIA up till now, to set the stage a little bit for the roundtable discussion that will take place after the coffee break. But just to put some questions that you can think about on how to move forward. As all of you know, we now have 4 new partner universities: Universidad de Alcalá, Universitat Hamburg, University of Novi Sad, and the Arctic University of Norway. So I think a very important question that we need to ask ourselves is, so we spent some years now to develop frameworks on how we can make inventories and evaluate research going on within the Alliance. How can we incorporate our 4 new partners in this work and then develop those frameworks even further? So that's something that we really need to consider carefully and try to develop good thoughts and ideas on how to do that. Another thing to also keep in mind is that when we develop those frameworks, we always said to ourselves that, yes, we're focusing on pandemics-related research now because that's very timely, being in the middle of a global health crisis on pandemic. However, the framework were developed to also be easily transferred to basically any other topic. So we can, if we as an alliance decide that we want to have another focus, or we want to specifically focus on one topic, another topic, we can easily use the same framework and apply the same framework to do that. So please take those ideas, thoughts with you, reflect on that. And then I think that the presentation by Petter Hartmann and Benedict Asamoah will provide you with even more perspectives from other angles that we can take into the roundtable discussion. So I'm going to stop there and thank you very much for your attention, and wishing you a nice coffee break. And for you that are physically in place in beautiful Porto, take this opportunity to network as well. And then I look forward to see all of you in about 15 minutes. Thank you very much.
So hello everyone. As Joaquin said, we are going to have a small break of 15 minutes. I don't know if you have any questions for Joaquin. No? So we're going to move on to the coffee break and we'll see you in 15 minutes. Thank you very much.
Welcome everyone again. So now we'll have a presentation from Peter Hartman. He's a CEO at Medican Village Innovation, and he's going to speak with us about tackling global health challenges, a perspective on cross-sectoral research and innovation. Whenever you're ready, Peter, please take the floor.
Thank you so much. I hope everyone can hear me and see me clear and loud. And thank you so much for inviting me. It's a great pleasure to be part of the back-to-back EUGLOHRIA events today. I, of course, would have loved to be physically with you today on stage, especially since it's a very gray and rainy and cold day here in Lund, southern Sweden today. But I have, unfortunately, an international delegation waiting for me right after this presentation, so it was not possible. So let me share my screen and see if we can get this presentation going. I hope you can see me now, and I do hope that I can get also my notes up. Here we go. Great. So let me start just to introduce myself a little bit. My name is Peter Hartman, and I am the CEO of a science park based in Lund called Medical Village. It's actually the largest life science focused science park we have in Scandinavia. So that means that all of our 180 companies, all the researchers and the life science and healthcare professionals that are working on the place, it's roughly 3,000 people are dedicated to improve people's health, basically. Yeah, but I'm not here to talk about Medical Village or the things we do on a daily basis here, actually, but more to share my personal perspective on how we can tackle global health challenges, what are the main challenges we're facing, and also touch upon how innovation partnerships and private-public partnerships can be part of that solution. So I've put together an agenda for today. I will start with an overview, and please bear with me. I know you're all experts, but I will anyway spend a little time on dealing with the main components of global health, and I will come back to that. I will also look into some suggestions on how we can deal with our global health challenges, and then, as I said, also look into how we can understand health innovations processes, and how you build strong partnerships. And I think that is super important, because quite often when we talk about global health like this, it's easy that you stand on very overarching and a very overarching context without coming into the actual how we do it. And that is what I intend to do with my presentation here. Anyways, let's see if I can make it. So when I started to build my presentation, I talked to a lot of people in my network, and I asked them on their opinions on what are, to them, global health, and what components needs to be included when addressing global health challenges. And it became quite clear to me that different people have different ways of looking at global health or understanding the concept of global health. So to avoid confusion, I thought that maybe it's a good thing to start by just nailing down what I believe is important. And this will form sort of also have an impact on the content on my the things I will discuss during my presentation here. And the first is, of course, very obvious. It's about improving health. That goes without saying. But the second thing is also very interesting. I think it's about uniting disciplines. And I will come back to that. I think EUGLOHRIA, of course, and EUGLO is a great example of how we can work together in that sense, and to build partnerships, because that is definitely also needed in order to attack or tackle the global health challenges we are facing, as well as a more activistic perspective, which is maybe also a bit complicated or even provoking to someone. But without this more activistic way of looking at equity and how we can achieve a more justice and better world in that sense, it's hard to talk about how we can actually, what measures we need to take. So that also needs to be included. And then, of course, reaching beyond borders, because that is the global sort of element of it. Maybe it goes without saying, but important to start with. And then, of course, saying that this is so much more than just, fixing our healthcare systems. There are so many more dimensions into it. However, I will probably lean a little bit more in my presentation on the health-related things and the factors directly connected to health. But just to start with, I would also say that, of course, there are socio-demographic factors that plays a major role. And with this slide, I would like to just highlight how closely related our life expectancy is to SDI, which means socio-demographic index. And you could see from this map in the 1950s how there was a really big gap between developed countries and developing countries, both in terms of SDI and also in terms of life expectancy. But then things happened, and from 1950 to the year 2000, what we noticed was that the countries that are already had a higher SDI rose faster, so the gap was actually widening. But then in the year 2000 and forward, what we have seen is that we have become more equal in the sense that the developing countries has closed the gap to the developed countries, which is really good to see, and also then states that how important it actually is to stimulate economic growth and to make sure that we invest in primary school and all these kind of socio-economic initiatives that is needed, because that will impact the health profoundly. With that said, I think one way to look at how we are actually doing as human beings is, of course, to look at life expectancy. It's just one out of many ways to measure how we are doing, but it's a really powerful one. And I know I showed this last time I talked in the context of EUGLO at a meeting in Lund. So if you were part of that meeting, please bear with me. It's the same slide here. But what we have seen is that, things has gone really well in terms of life expectancy. If we can look away a little bit from the last 2 years with the pandemic, obviously, having a very negative effect on the life expectancy. But what we know is that if this continues, we will see a continued, I would say, growth over the coming years as well, which of course will also affect a lot of things in terms of how much cost we need to spend on elderly care and how much cost we will spend on the healthcare system. But it's of course really good to see that all parts of the world is increasing the life expectancy. So the question is then, what is the biggest threats or the most common death issues we have to face? And we are talking about heart diseases, we are talking about stroke, chronic obstructive pulmonary diseases, lower respiratory infections. We talk about Alzheimer's and dementia, substance abuse, etc. Diabetes, of course, is also a really important one. And most of these things could be seen as something we could, to some extent at least, prevent. There are things that are related to our lifestyles, which also talks to that we need to work very proactively in how we can prevent these things, but I will come back to that. The thing I would like to highlight here is obviously the pandemic and the flu. And since I started out with the slide of the basic, the very important things of discussing global health, I think this global perspective is super important. And we learned something really important from the flu, and that was that a pandemic doesn't care about borders, national borders. What really made a difference was that people came together from industry, academia, and the public healthcare sectors, worked together to find a solution, and we managed. That is the most important conclusion to draw. But another really important conclusion to make from that experience is also how fast we, from a political side, closed the doors and started to look inwards. And I think it's very naive to say that, I mean, just closing down the borders will stop a pandemic. That won't help. And I think instead what we need to do, to some extent, maybe it helped, but what we need to do is to keep that global mindset, because that is what will help us going forward. So the question is, where are we heading? In some cases, of course, as we could see with life expectancy, we are moving in the right direction. Things are going really well. Other things are not going that well. And that, of course, also paints the picture of what measures we need to take in order to improve our global health. But let's start on the positive note then. So what is going really well is actually that we see a reduction when it comes to child stunting, when it comes to alcohol consumption and tobacco use. We see that sanitation aspects is also going well in terms of more people have access to to pure drinking water, basic hygiene, etc., etc. And this is definitely something that impacts our global health, in a broader sense. But then, of course, we also have some things that are very negatively impacting our global health. And one issue is air pollution, for instance, both indoor and outdoor. I think everyone can relate to a picture of, let's say, Mumbai or Beijing or another mega city around the world, when you see the smog and the smoke covering the cities. It's just amazing how we can stand and how we can cope with that situation going forward. I think it will actually definitely get worse before it gets better in that sense, since we have a very strong urbanization trend still. But there are also some things that are worrying. Non-communicable diseases, NCDs, such as, for instance, cancer and diabetes, is also going in the wrong directions. And if you remember the slide I showed you with the most common death causes, a lot of them are NCDs. So that is definitely something we need to be aware of. And if we take diabetes, that was also on that slide, and one of the most important issues we have right now. I think one way to illustrate how big of an issue this is and how big of an economic issue this is, I can take an example that is very close to me, actually, because just on the other side of the pond from where I sit, we have Copenhagen and the Danish capital, and it's 50 minutes away with train. And in Copenhagen, you will find the headquarters of Novo Nordisk, the big insulin and diabetes giant in Denmark. And just by looking at their stock price, and this is what the graph is illustrating here, and what a lot of newspapers today is writing about, is how extremely strong the development has been for and the demand for their services and products. Obesity is increasing. So if you can find a solution to obesity, that will be, something that will generate a lot of money going forward. And right now, actually, Novo Nordisk is bigger than the whole Danish economy together. So just, finding cures to these NCDs is a really big issue also financially. So 7 out of 10 deaths worldwide today is connected to non-communicable diseases, such as, for instance, cancer and diabetes, etc. And this also illustrates that, I mean, it's time to do something about it, but we cannot forget the fact that the communicable diseases, such as infectious diseases, are still a big problem in developing countries. And that makes the problem even bigger for them, because in that case, we can talk about the double burden of diseases. And this is once again where this equal, the activistic approach comes in. We need to deal with the fact that they are fighting this double burden, and that will cost a lot to fix that problem going forward. And when talking about costs, I mean, of course, this has a great or a major impact on our national economies. If we look at the world healthcare spending from the last 20 years, from the last 20 years, yes, you can see this is the same sort of graph, just illustrated in different ways as share of GDP or as share of per capita, the world healthcare spending over the last 20 years. And what you can see is that, I mean, the main message here is that the costs in our healthcare system is escalating. So the question is, can we afford to continue like this? And I guess the answer is no. So what can we do then? That's the million-dollar question. So this is where health innovations in different ways comes into the picture. And I will give you a few ideas or point of views from my side on what type of invention could help. And to start with, I think digitalization is obviously something that we need to take into account. Digitalizing the society in general could really make some major positive effects, of course, not only for our health, but also for the healthcare system. So using, for instance, apps, we can empower people to better manage their health. That is quite obvious. But a more faster digitalization of the society could also support the healthcare professionals to diagnose and treat diseases more efficiently and confidently, and then also help the healthcare system to provide care in maybe a more cheap and effective way. And if I take another example just from my own situation here in Sweden, I mean, we have 21 different healthcare regions in Sweden, and we are still struggling with finding ways for our digital healthcare systems, journal systems to talk to each other. And I mean, that is just only in Sweden. And then we have the EU, I mean, to find solutions to that. And of course, seen from an integrity point of view, it's super important that we are not gambling with people's integrity. But I can assure you that if I fall sick, really ill, in, let's say, Portugal, then of course, I would really appreciate if my healthcare region in Sweden could transfer my journals or whatever healthcare data they need to treat me in the best possible way. And this is something we need to of course, work on going forward in the EU, I think. Another point of view when talking about digitalization is also, of course, to mention the rise and the role of artificial intelligence to sort of improve healthcare globally. I'm certainly not an AI expert, so take it for what it is. But what I've noticed is how fast the development has gone over the last couple of years. Just a year, 2 years ago, I think many of us hadn't tried out ChatGPT, for instance, and when we tried different chatbots or different AI tools, many of us laughed a little bit on the odd answers we got or the things that came in wrongly in the results. But today, I mean, just a few months ago, it's really hard actually to tell what is written by a human and what's not. And this will be a big challenge on the one hand for, in an academic setting, but it will also help us in many ways going forward. And when the technology is developing and things are going good, and I'm sorry for not having a source for this investigation or this piece of research here, so I cannot talk about how many people have answered, but this is more to give you a glance of what we're heading. What you can see here is how people actually felt when talking to either a physician or a chatbot. And you can see the chatbot comes out very well in this scoring. And the same goes actually not only for the correct answers, it's also about empathy ratings, which is a bit maybe worrying for physicians. And I don't think that this will, make physicians unnecessary to have in the future. That's not the message here, but more that things are moving really fast within this area, and we can expect more chatbots, etc., to be part of the healthcare systems. And to tie it back to the topic of today, a really good health invention here. WHO has just launched the world's most extensive, freely accessible AI health worker now globally, which will be really interesting to follow. So that is one way of dealing with it. The other thing, and the other way we can deal with our global health challenges is, of course, to work with prevention. And that was what I mentioned initially when we looked at all the biggest or most severe healthcare issues we are facing right now. But prevention, one big issue with prevention is that everyone talking about prevention, everyone seems to agree on the fact that we need to do something to invest more in prevention. But still, if you look at where the money is going in the healthcare system, it's not to prevention. Only 3% in general in the EU is investing into prevention in the healthcare system. And one might ask, why is this the case? I don't have the answer, but I think in one way, one explanation could be that our political system is geared so that the politicians need to make investments here and now that could be measured or prove to be effective in a quite short time limit before the next election. Otherwise, it's really hard to get re-elected, right? But preventive measures is taking a cost now that hopefully will pay off in, let's say, 10, 15, even 20 years later. I can understand that that is a hard decision to make, to escalate the costs here and now, and maybe have to raise the taxes going forward. I can understand that that is a problem. I don't know if that's the explanation, but I expect that the investments in prevention will increase going forward. Unfortunately, I mean, if we look at the economy right now, it's quite tough in many countries. We have seen higher costs for energy prices, inflation, etc., and the industry is also struggling. I mean, the CEOs of European countries answered PwC when they asked about their outlook for the future. They're very pessimistic right now about the growth pace, etc. And this is a problem because that will mean that we will see less money coming from corporate taxes into our public systems. And this is really when we need it, actually. So not to be too depressing here, I think what we can do then, my third bit is, of course, to work even more proactively with education, research, and other type of innovations. And the question is, how well equipped are we in the EU to take the forefront when it comes to health innovations, for instance? I mean, if we look at the innovation capacity, that has actually been growing quite well over the last couple of years. But we are still lagging behind the US, South Korea, Canada, etc. But we're doing pretty well. We are doing pretty well. There are quite big differences between the different EU countries. That's one issue. But I think at least the innovation capacity is going in the right direction. So it seems like we have the right condition. The problem is, though, that the investments in R&D, and we are talking about private investments here in the R&D system in the EU, is not increasing. And I know it's a lot of lines here. I don't know if you can see it clearly enough on the screen, but the blue line is representing the EU over the past 10 years, how much money we have seen being invested in R&D from the private sector. And the yellow line, which is probably the most important and interesting line here, is China, that have increased their investments in a very fast way. And in 2022, China actually surpassed the EU in terms of R&D investments from the private side. And that is to me really worrying, actually. So how can we understand and improve health innovation processes then? I talked about the important components to understand global health, and I will just sort of list them again. And I would say that if we or you guys are going to work together, it's important to include all the different aspects that we have talked about during the presentation so far, and make sure that you have access to the expertise needed in the partnership. And when we talk about a partnership, we need to include the private industry, we need to include the public healthcare sector and the civil society, to make sure, of course, also academia, to make sure that we have this kind of triple helix way of thinking when dealing with the health challenges and creating the processes that needs to be in place. So let me spend just a couple of minutes on, or it's not that many minutes left, but a few words at least about the health innovation process. And this is where we become a little bit more concrete. This is my way of illustrating how you can look at an innovation, a health innovation process. And that differs a little bit from just an ordinary innovation process, I would argue. So the first you need to start with is, of course, to co-produce a problem or to identify the problem. And then build a strategy around the challenges and around the theories you have from academia. So we're always basing it in theory. And then you need to look at the design and make sure that you have based the design and the research on the identified problem. Making sure that you have knowledge and service and technology developed in collaboration with stakeholders. And remember, it's in a collaboration, it's give and take. So you have to spend a lot of time in just identifying how these different components or the different competences can come together. And then we come to the output phase and the implementation, where models and methods for intervention and change management can be tried out. And of course, you need to evaluate and follow up based on the effects on the methods you have chosen, and then look for strategies and how you can, spread or gear up the solutions you're providing on a global level, and then of course start to analyze. Are we on the right track? Do we need to change or adapt the way we work? And then, start all over again, or at least start adapting the process to make it more efficient. That is the basic steps I think should be included in an innovation process. Very briefly, there are always hurdles, and when I've looked into some of the health innovation initiatives worldwide, I've tried to look at USAID, for instance. You can find it on their website. There are a lot of problems connected to, for instance, that the innovators didn't understand the problems they were trying to solve. They were more innovators than public health experts. Technical hurdles, it could be, that it was too expensive, very common also, or the transition from academia to a startup could also be a big hurdle. And this is something you need to also address in the way, in order to take the next step. So then, of course, to evaluate the health innovation, you need also some tools, and I'm wrapping up here. I will take this very fast. This is a suggestion on how you can look at a health innovation, either if it's yours or someone else, and to look at, does it help? Does it make sense? And of course, you need to look at the health impact and see if the innovation is actually doing what it's supposed to do, if there is a strong demand and sustainability, and then look at the competences included in the organization. And lastly, of course, to look at the possibility to scale the invention going forward. And that is, absolutely crucial. And then you can, of course, find many ways to look at these factors and use different criteria and rank them in different ways. But hopefully this could be helpful for you when looking into health innovation processes. Lastly, I will share some examples of health innovations, but I only have 1 minute left. So I will just say that there is a lot of great examples to find on the web, obviously. I think the best examples I've found is when I can see a clear combination of industry partnerships, several industry stakeholders working together with a local or a national governmental organization, together with schools and healthcare professionals, etc. There is so much to dive into. You can, for instance, find it on globalhealthprogress.org if you're interested to look into it more in depth. So to summarize, I think my time has ended. I think what we need to continue to do is just to embrace the fact that the world is changing. There are challenges and there are pros and cons with everything, but for sure, without a strong education system, without investing in research and development, we will not be able to cope with these challenges, the health challenges that we are facing. So I feel that that is probably the most important thing we can do. And that will be also a very clear return on investment at the end of the day. So I think it's easy to sell that to our politicians. And finally, the main message here is, of course, that we cannot solve our problems with the same thinking we used when we created them, as Albert Einstein said back in the days. I think this is truly valid still. So with that, I would like to thank you all for the attention, and yeah, thank you so much.
Thank you very much, Peter. Our next speaker will be Benedict Oponga Samoa from the University of Lund with the workshop section Working Together on Research, Education, Innovation Experiences from the Global Academy in Africa. Benedict?
Yes.
Go ahead as soon as you can. Thank you.
Hi, is my screen visible? Hello, can you see my screen?
Now it's white only.
Hello? Did you? Yes, we can see it now.
Thank you. Thanks very much for this opportunity to share what we are doing with the Global Academy and in terms of innovation, research, and capacity development. My name is Benedict Oponga Samoa. I am an associate professor in global health with social medicine and global health at Lund University, and also a program director in the master's program in public health here at Lund University. I would like to share some of the work that we are doing in our Global Academy of Sexual Reproductive Health and Rights, which includes a combination of research, capacity development, and education, and how we bring these together within this platform. Through the long-term engagement in capacity development with countries across Africa, Asia, and Eastern Europe, the Division of Social Medicine and Global Health, SMGH, at the Faculty of Medicine at Lund University has established a global pool of experts And these experts represent different sectors, organizations, and approaches within sexual reproductive health and rights. And as a response to this expertise, the Global Academy of Sexual and Reproductive Health and Human Rights was established as a platform for research, education, innovation, connecting diverse SRHR actors from across the globe. And SRHR is at the core of everyone's being and lies at the strategic intersection between global health and the universal human rights, with aspects such as gender, equity, poverty having great influence on the realization of SRHR for all. So that achieving the Sustainable Development Agenda is not possible without achieving SRHR. And this requires individual organizations' capacity of knowledge creation and also institutional and individual capacity development. So in 2018, the Social Medicine and Global Health received funding from the Swedish International Development Cooperation Agency, SIDA, for the development, further development and establishment of the Global Academy, which I would now talk about. Of course, there are many ideas that have come up and that have been discussed over these years, but also some challenges, and I will share how we have gone about with this. First and foremost, establishing a Global Academy of Sexual and Reproductive Health and Rights has been a fascinating process. But again, logistical complexities that is caused by the expansive geographic coverage of the members who come from about 38 countries have also been a challenge in terms of, for example, coordinating time zones for virtual meetings and organizing events and so on. But these are just minor things when it comes to the achievements that the Global Academy have made. The membership of the Global Academy also is heterogeneous and represents different countries, different cadres and professions, and I'll show some of the categories later on. And this brings its own challenges related to advocating for sexual and reproductive health and human rights in different political, legal, and cultural landscapes. Of course, there are many different networks that address sexual and reproductive health and human rights, and that work locally, regionally, and globally. However, there are a number of factors that make the Global Academy unique. First is the membership of the Global Academy. One of the unique elements of the Global Academy of SRHR is that, and that sets it apart from many other networks, is the requirement that all members must have completed one of the capacity development programs run by Social Medicine and Global Health, or have been an active team member in one of these programs. That means that all members have successfully completed an advanced course at Lund University, or a course at an advanced level at Lund University. Then, in addition to providing a shared understanding of key concepts and a guarantee of quality, every course includes a number of weeks where participants stay over a long period of time together. And then this shared experience within and outside of the teaching environment nurtures a strong sense of community within the Global Academy family, and also fosters exchange of knowledge and experiences and perspectives. And that supporting this exchange between participants from different parts of the world has shown to expand perspectives and also give rise to interdisciplinary approaches in the programs within the academy. And the academy deals with topics that are controversial sometimes, and also often imbued with complex political and social implications. So knowing that every member of the academy has undertaken a similar journey through the program has created a foundation of trust that is cultivated among members through shared values and the opportunity to socialize and connect in a setting away from their usual context. And this trust paves way for candid dialogues, enabling participants to share diverse perspectives in a safe and constructive environment. And also the Global Academy represents a huge variety of experts working in SRHR, both in terms of their geographic distribution, but also in terms of their diverse sectors, professions, levels, and cadres. Some are high-level personnel, some are middle level, low level, and so on and so forth. And this diversity often offers both knowledge exchange, as I mentioned before, but also opens a door for collaboration and opportunities within and between countries. We have a website that has been developed, and then I would mention a few things about it later in this presentation. And this website has an internal phase for members of the academy, which provides a platform for coordination of the academy's activities, but also an external website which can also be useful for non-members. Here are some examples of the capacity development work at Lund University. So we've had the ITP SRHR programs in 2 batches. We have the first program, which ran from 2005 to 2010. And within that, there are several batches of participants that went through this capacity development program. And then we had a second contract, which ran from 2014 to 2022. And we've also had a national training program in India for young people. And this led to the Global Academy of SRHR, which I would I would come back to in my presentation. And then from there have been different activities that have been undertaken by the Global Academy. So, for example, we have the PSIP, the Public Sector Innovation Program, which is a Swedish institute-funded initiative that aims to strengthen the capacity of professionals to contribute to innovation in the public sector and support implementation of the Agenda 2030 for Sustainable Development. And since its inception in 2019, the Global Academy has arranged and implemented public sector innovation programs in the collaboration with partners and universities across Africa. And the programs are focused on sexual and gender-based violence and has been implemented with strategic partners at the different ministerial levels in Ethiopia, South Sudan, Uganda, and in Zambia. So those are some of the selected programs that you see on my right, and this I will come back to in the presentation. The programs are built upon experiences of the ITP in the international training programs, with increased focus on anchoring change projects that they have undertaken with all relevant stakeholders, and then relocating the training phase now from Sweden to the regions where the participants or the stakeholders are. So in this way, the Global Academy has been responsible for the design and implementation of these programs that have spun out of the Global Academy from inception to evaluation. And then a number of projects have been built upon the change projects that they had in the international training program. So I will now go ahead to explain how the process of the international training program has been, and then how this has led to the Global Academy and what we are doing now, and some of the results that has also spun out of this process. So the international training program is an advanced training program that is ITP for short, in sexual reproductive health and rights, and it's at a 22.5 ECTs credit course at Lund University. And as I mentioned before, The first contract was from 2004 to 2010, and then we had a second contract from 2014 to 2020. So the model that we use here at Lund University for our training is that we have divided the training program or the capacity development into 5 main phases. The first phase includes preparation in the home country. So what we do, or what we have done over the years with the training programs, is that we select participants. Of course, after advertisement, we select participant country teams from each country. And normally we usually have had about 30 in a batch. Sometimes we run double programs where we have 60, so it's 30-30. So roughly about 5 participants from a country, and then they prepare in their home country, think about things or projects or needs within their country that they want to address. What kind of change would they want to see in their home countries? And then from there, we start to give them guidance. And they come to Sweden. So we have had scheduled programs in Malmö at Lund University, where we now do capacity training. We do training for a period of about a month. So there is a period where they stay together. That's the phase 2 of the process. They stay together for about a month, interact with the team, interact with each other. And during this phase, although the participants are very knowledgeable, even before they come to Sweden in the areas that they work, we see it as an opportunity or advantage to help them in structuring their objectives and the goals for their project, because many of them are used to practice and not so much used to the research and educational environment per se. So that is what we supervisors from Lund University and teachers and researchers do to help in streamlining the outcomes for the projects in line with the activities and so. So they shape the projects, and then in the phase 3, they return back to their home countries and implement the project. That's the implementation phase, which is about a 6 months period. So within these 6 months, they implement the projects with a target population, with a target group in their countries. We follow up, the supervisors follow up to both strengthen collaborations with the different stakeholders and the organizations within which they are working, but also to help them with tips and so to strengthen their efforts on the field. These are some examples of a project, how the outcome of the project phase. So normally what happens, for example, here we have the 3 projects that I've put here: task shifting of post-abortion care from doctors to nurses. And this was done in a hospital in Zimbabwe. Then creating access to pre-exposure prophylaxis among sex workers in Addis Ababa, Ethiopia. And the third one is increasing the uptake of screening at Soba hospitals, cervical cancer prevention and research unit in Sudan. So when they have now implemented and then put together the results, the phase 4 is a results seminar where we now gather to share results and then plan for moving forward, the sustainability phase. How do we now ensure that our results are sustainable? Of course, we already discussed this during the first phases, but then at this stage, they also put together a concrete plan for sustainability in how aspects should be sustained. And we have seen that there has been tremendous and very much encouraging results at different levels, including, some bills, laws, policies at the national level, and different organizational change that has come out of these processes in different countries. With over 900 members across 38 countries, the Global Academy represents both a huge resource for members, but also for the external community and a complex and a heterogeneous organization. This is the map of currently which countries the members are, mostly in Sub-Saharan Africa, Asia, and Eastern Europe. The vision, mission, and objectives have been collaboratively prepared and checked on a regular basis against the views of the Global Academy members for their relevance in an ever-changing SRHR landscape. So the vision is a global development in which needs regarding sexual and reproductive health and rights are effectively identified, met, and sustained. And the mission is to facilitate SRHR in local communities among health care providers through joint development, implementation, and dissemination of strategic knowledge. And the objectives are to develop a platform for dialogue between local communities, healthcare providers, and researchers regarding need for local knowledge and interventions. Identify and promote participatory approaches for priority setting among SRHR interventions. And then develop capacity to mobilize and utilize resources and knowledge to meet the SRHR needs in local communities. And finally, to engage community leaders, healthcare providers, and researchers in the monitoring and evaluation of SRHR practices, services, and interventions. Of these 900 members from 38 countries, they come from a variety of organizations and levels. So we have members from universities and research institutes. We have ministries of health, ministries of education, ministries of gender. We have some from public prosecutor offices. We have the police represented. We have non-governmental organizations represented. We have people from media and media organizations represented. And we also have people in healthcare service and service delivery also represented. And that is the uniqueness of the Global Academy, to be able to bring all these aspects and expertise with diverse backgrounds and knowledge together for innovation and collaboration. Here are some selected activities. As I mentioned before, the public sector innovation programs have led to joint programs in sexual and gender-based violence and human rights that have been conducted in Uganda, Ethiopia, South Sudan, and Zambia between 2019 and 2023. And in the late 2020, all members of the Academy were encouraged to submit applications for new creative or best practice interventions in SRHR with the potential to address specific health challenges in sexual health, sexual rights, reproductive health, or reproductive rights in their communities. And a total of 70 applications were received from 13 different countries. And then applications represented a variety of topics, sectors, and challenges within global sexual and reproductive health and rights. And 5 projects received funding for this first call, 2 from Uganda, 1 each from South Sudan and Zambia, and 1 in Mongolia. Then we also have the multi-country midwifery initiative, which is aimed at advocating for strengthening midwives and midwifery and midwives' role in India, Cambodia, Liberia, Zambia, South Sudan, and Uganda. And this was at the policy level. So it also was an activity carried out by the Global Academy, the trainings in the Global Academy, and it also brought together experts from both Africa and Asia and Sweden. So there were midwives from Africa and Sweden who were also involved in this training. And since 2020, the Global Academy has utilized a member website that I spoke about to organize activities and as a space to share ideas, information, and calls, and also support, as well as a site for collaboration and learning. So this website was piloted prior to the use and is continuously developed and to provide best practice experience for members. And some of the features that have received positive review is the podcast. There is a podcast that is a Fika, it's Swedish word Fika, with Global Academy. It's a member-driven podcast recorded and edited in Uganda. So as you could see, the interactions and experiences from Sweden led to the member adapting the Swedish word Fika, which now became the title of the podcast. And the podcast raises voices of the members on a variety of issues. And it's a standalone episode, or it could also be a thematic series. Then we also have the blog, which is in addition to the podcast, written text and image-based messaging that has also been utilized in the website. Then there is the audio drama. For example, we have something called The Public Secret. That was a 5-part resource developed by the Global Academy members across 3 countries. And that deals with the complex issues around sexual violence and abuse for women and girls living with disabilities. The audio drama was written, recorded, produced, and released by the members. And it's a useful tool for discussing sensitive issues and an accessible entry point into the topic. Then, of course, we also have the horizontal learning through blogging, which more often is peer-to-peer learning. Then we have an external website, while the internal Global Academy website aims to support and encourage members among and between engagement among and between members. The public website's purpose is to disseminate information about the Global Academy to the public. And this includes information about what the Global Academy is about, who the members are, what projects are being concluded, and what are currently being done and planned, and so on. Then there have been 5 PhD projects that have sprung up of the Global Academy. So some have already completed their PhD, and some were an offspring of the change projects that they carried out through the international training capacity development programs. And then there is also a PhD research that has was completed last 2 years by a colleague who evaluated the effectiveness of the ITP program. This is the conceptual framework. I'll just give a brief overview of the findings of the evaluation of the International Training Capacity Development Program. So the conceptual framework focuses on individuals, organizations, and an enabling environment. What factors facilitate and inhibit the propagation of knowledge, but also a successful capacity development program in terms of innovation and other aspects of practice. So the aim was to evaluate the effectiveness of the ITPS-RHR and understand the role of different contextual factors in capacity development for healthcare systems in low and middle income countries. Study 1 and 2 aim to assess the individual healthcare providers in their working environment before the intervention. So to look at what was their status, how is their working environment, what are their perceptions and attitudes and so on before they had this training or intervention. Then the study 3 in this PhD assess the effect of the ITP intervention on individual healthcare providers after the intervention. And the study 4 looked at the effects of the ITP on the organizational level, on organizations, and also the target population after the intervention. So the specific research questions were, did the ITP in SRHR contribute to changing healthcare practitioners' SRHR knowledge, attitudes, and practices? Did the ITP SRHR contribute to improving organizational effectiveness, increasing awareness and demand for services, promoting sexuality education, improving access to SRHR services? Then, in the early 2020, the Global Academy started receiving reports from its members on how COVID-19 was affecting SRHR services. Together, the global experience effect among SRHR workers, the Global Academy invited its members to answer an individual survey between October and December 2022 about the effects of COVID-19 on SRHR. And the results from the survey among SRHR professionals in Africa and Asia from this Global Academy, we had 230 Global Academic members who responded to the survey from 23 countries. 52 of the respondents represented government agencies, such as ministries and hospitals. The questionnaire comprised a mixture of multiple response and free test answers, and descriptive statistics and thematic analysis were used to summarize the results. Then from this, we saw from the results of the survey that 55% of the respondents experienced large to very large negative effects on access to HIV testing, 50% on HIV treatment, 52% on pre-exposure prophylaxis, 62% on services for men who have sex with men, 71% on services for female sex workers, and the reported experienced effects in Africa were larger than in Asia. Thank you very much. That is the end of my presentation. And if you want to have more information or if there's any follow-up, you could always reach out to us in this contact, to myself or Annette Ogard with the contact provided on the slide. Thank you.
Thank you very much, Benedict. We will take a small recess right now until 11:45, and we'll be back to the roundtable discussion. Thank you very much.
Joachim is there?
Yes, I'm here.
Okay, great.
I can see you well, the whole panel. Hear you loud and well. Hey, Rick.
Okay.
Hey, Miguel. Hey, Zoltan. And hey, Enrique.
And Benedict and Axel. Okay, perfect. We are all here. Okay. Well, we have around 1 hour to discuss some difficult matters. I must confess. We have a very very senior and completely male panel, which nowadays is a very unexpected thing. I cannot but you know, we with EUGLOHRIA, we tried to focus in this specific group and session on a central theme for our days that remains. In fact, although WHO defined as it's traditional to do at the end of the pandemic, it's very difficult to say that it ended. So we have with us Joachim Esbjørnsen. You already listened to his presentation. He's professor at University of Lund. From Lund also, we have Benedict Opong Asamoah, who also made a presentation on the Global Academy for Sexual Health and Reproductive Health. We have with us from Germany, Axel Imhoff, who is a molecular biologist, and we'll bring a different look at all this. And here we have Professor Eric Cassin from the University of Paris-Saclay. We have Zoltan Konya from Szeged, and we have Miguel Souza from Porto. He's an economist. So we have this diverse panel of people to try to answer mainly two questions. If you allow me, I would propose a first round, and you might identify in the way I put questions, not my name, of course. My name is Eric Bausch, but my background and my work at university as a public health scientist. One of the things you had to do today is to think a little bit about what we did, what happened. Maybe you can remember a well-known saying from Oscar Wilde that says that experience is the name we give to our errors. So my first question for all of you would be, can you identify errors that we might change, that we might that might bring information and knowledge for a next pandemic or a next health crisis, which is something that we all know sooner or later will occur. And for instance, just to remember that we are facing things that were not here before. It's enough to look at Spain, just the neighbor, and know that they are leading with things like West Nile fever or other infections that some years ago were not present there. So, Miguel, do you, as an economist, namely, can you go into because at least the pandemic had lots of financial impact in health, which can you identify some things that you learned, some experience that you'd like to share?
The errors. It's not easy. Let me think a bit. In terms of the economics, the experience we have with the pandemic we live, I really believe, but it's my opinion, the governments in terms of the economies, they defend very well the economy. In that case, I have nothing against the decisions made by the European Union, by the governments. It's clearly they made the companies, the jobs were kept by the support of the government. So I'm trying to point some errors. It's in terms of economics, I don't think they could do it better. Of course, they always can do it better, but I cannot come with a different way of doing to defend the well-being economic. I'm talking about economics, the financial part. I cannot see how could they make different. People were at home, the economy simply stopped. But even I believe that most of the people could keep living, could keep their jobs with the support of the government. We know that now it's time to pay off, because all the support that the government has given to the companies, to us, is need to be paid. And I know that companies are suffering a lot to cope with these debts. At least they were able to survive. I believe that now, they are making maybe the big error, because they are pushing the companies too far to pay these loans as soon as they can. And I believe they need to extend the support to the companies. Otherwise, with the crisis, with the wars that come out, it won't be easy to the companies. So in terms of economics, maybe in terms of public health, we have a lot to learn. We tend to forget because the crisis happens. It looks like every 100 years, last pandemic, at least as we know, and we forgot maybe all the things we learned 100 years ago. But in terms of economics, for me, it's hard to find. Maybe I can come with time with some things that could be have been done better. But I believe the government went straight to the point. Makes very important people to keep jobs, people who were not working and were able to keep their income, and that was very, very important. This is what I have to say.
Miguel, just of course, to a certain extent, it was just a sort of a glass breaker. But I mean, we are facing today in this discussion how we can look into the future, and as sort of a continuation of the EUGLOHRIA work, topics that might be shared or some network. In the end, my question is, do you think we have done enough research as a group? Because when we looked at the Joachim presentation, it's mainly the biological, the clinical, the epidemiological, the health directly, let's say, health related aspects, and I missed some sort of thinking about how to prepare society, how to think about the economic aspects of all this. Could it be a needed network that we need to create, or a sort of a sub area for interest in the future to continue and to be better prepared for future?
Yeah, in that case, I can move to innovation. And yes, the governments can support more the innovation, and this type of alliance can help first the research and can help then the research to move on to innovate products, innovate services, and somehow we can find better ways to tackle pandemics in terms of new technology, new research, and that must be support for government. And this alliance has this impact. This, I'm completely sure, the alliance, the EUGLOHRIA project at 5, but then the alliance at 9 will clearly increase not only the research outputs, but will be able to have better innovation products who can support much better the innovation, the innovators, and then we can bring benefits to the future. And I believe not necessarily in Portugal, but I believe the European Union has supported the innovation. I can see that not in Portuguese case. I present that to my students. Portugal is one of the clearly is the second from last European Union country in terms of spend on innovation over GDP, but in terms of the European Union, we are not so far. So we can benefit as a one. We can benefit from programs, on the initiatives we take care to help our innovation, our research to go to innovate products. In that case, yeah, we should have learned that we should bet on innovation. Hopefully, at least the Portuguese government learned that, and they can invest even more in innovation, because it's very important in terms of the global health, in terms of the pandemics. We may have some change our behavior, we can have some good habits, wealth habits, but I believe the ways we can better tackle future pandemics problems will be with innovation ideas, innovation solutions, and then we need to invest more in this kind of solutions. And the Alliance can help on this. I don't have any doubt. The EUGLOHRIA project proves that we as a 5 and then as a 9 will be much more than the sum of the parts. We can share a lot of knowledge, we can share a lot of infrastructure, we can share a lot of initiatives. We can offer to the private sector, as Peter Hartman was speaking in this talk, we can offer a much better value proposal to the private sector to cooperate with us in order to promote innovation. This I have no doubt at all that we can, as an alliance, to improve our innovation rankings, if you want, our innovation outputs. As a one, we can bring the private sector much more involved with us because we have much more to offer. We can offer 9 universities, we can offer 9 cities, 8 different countries to our business partners. And so that can be very helpful, even to tackle the future pandemic.
Thanks, Miguel. Eric, as your responsibilities at European Affairs of your university at Paris-Saclay, and again, looking a little bit, sort of taking stock of what happened during these years and the experience of EUGLOHRIA. I mean, which are your thoughts regarding continuity of funding and a sustained development of the alliance in the near future?
Thank you. Thanks a lot to the organizers of the workshop and the conference and the back-to-back event in Porto, by Porto University, Porto. Your question is a bit difficult. First, it relies on the involvement of the communities, the research communities, also following the strategic vision of the universities, but of our universities. And indeed, we are 9. It would be so great also to have the feedback of the 4 universities which have entered the Alliance on January 1st. Regarding the sustainability of the approach, I think that the European Alliance, and especially the research dimension of the European Alliance, has benefited from the strong involvement of the people who have contributed. But in the same time, this is the feeling that we have, they have represented probably a small amount of people in our universities. And this is absolutely normal because we needed a task force of involved researchers, involved managers, etc., to boost the research project, which is one part of the Alliance. EUGLOHRIA is a research innovation action of the EUGLO European Alliance. So this is part of the, okay. So one perhaps clue for the future would be to rely even more on the young researchers. I would say that the researchers who have not already established their networks throughout Europe and throughout the world may be a good target because they have energy, strong energy, and also they need to establish their networks. So I would say that set of researchers within our universities could be specifically targeted, and we could encourage them and help them to submit new proposals, new projects, because indeed we have a vision, we have an alliance, etc. But the alliance needs to be in terms of not only of strategic, but also on financial sustainability, but also on the viewpoint of strategic sustainability. The alliance needs to be fed by research projects, and so young researchers could be a good option, provided that we help them also. Another clue would be perhaps to draw more connections between. It's a very common and basic remark. But anyway, we have made so many great things, but we have not fully succeeded in having a very tight connection between education and research. And we could have also an action in terms of perhaps of lobbying at our national levels and at the level of also the European Commission in order to get, there have been many discussions at the level of the European Commission. You know that there are two main directions in which we are connected to, the direction for education and the direction for research, the so-called DG RTD and the DG for education. And there are the European Commission directions have sustained us a lot. But if we would have some new projects, a new type of project connecting both education and research and relying on the European alliances just like ours, it would represent also a great help. I mean that the financial support, the fundings would be open in relying on criteria based on excellence. Of course, this is needed for any competitive call, but the new type of call could both associate education and research, which is not the case for now. Okay.
So if I understood well, what you are telling us, it's in our hands to kind of design something innovative, something challenging, where we bring together our expertise, our cultures, our knowledge, and we advocate for something new that bringing together research and education might be worthwhile for the Commission to finance. That's the. Did I summarize well?
Yes.
Or I'm being too optimistic.
We can rely on the tools, but it's not only a matter of tools, it's also a matter of a strategic vision. I think that we have had already many interesting discussions, including at the coffee breaks. We share a common will to develop much more the network, and there are many opportunities to do so. But indeed, for the immediate, because one part of your question was, what about beyond EUGLOHRIA? In fact, EUGLOHRIA is the first set of research activities of the EUGLO Alliance. So it's on behalf, it's within the umbrella of the EUGLO European Alliance. So basically, if we continue to share that the vision that much more research activity would be needed, especially to address the pandemic research topic, which is very important, which has delivered many outcomes throughout EUGLOHRIA. This is something much probably to continue and to reinforce again further for sure, within perhaps the so-called focus areas of the EUGLO Alliance. But practically, we also need projects. So we have also to think in terms both of strategic vision, but the implementation of the strategic vision is probably to be implemented throughout projects, research projects. So we need PIs, and probably we need to encourage young researchers. And at the same time, to continue to discuss with our national levels and the Commission. You have, for example, in Portugal, you have provided a program, and you have succeeded to obtain a program for 30 PhD scholarships fully paid by Portugal from the national level of Portugal. It was so great to have that. We may have not the same, but another initiative from another country. It's the case in different countries. Okay, but not necessarily throughout a similar program, but something else to promote mobilities, etc. So we need also projects following the strategic vision, and this is part of the sustainability.
Well, and the founding of science is not increasing, in fact. So one need to be careful and try to create situations that promote sustainability, because otherwise it's.
So my reply was much more oriented towards research projects, etc., public money funded, but also something that was pointed out by Peter Hartmann from Lund University, and also by Miguel just now. The relationships with the companies, the private companies, is very important, and there is indeed a very strong potential within the EUGLO Alliance. 3 years is very short. EUGLOHRIA has only achieved works since 2021. So the common knowledge between our universities, we have different, we are all European countries, and this is the reason why we are here in a strong alliance, but we have slightly different cultures. We have, even there is some diversity between universities from the same country. We have a single country with 2 universities, and we already see that the practices of the 2 universities of the north, between the north and the south of Germany, are not exactly the same. So 3 years is very short. We have achieved a fantastic work throughout EUGLOHRIA, and there is a strong potential, and indeed in connection with the private companies. We have heard that within Medical Village in Lund, only from one of the 9 universities, Peter told us that there are 180 companies in the health sector. So we need the people from the company, the experts from the companies to be part of our trainings, because we need to have high-level trainings. We have many training activities through in the EUGLO Alliance. We could invite even more stakeholders, experts from the private companies, but also there is plenty of developments, of possible developments to develop research and innovation projects, be them funded from the Commission or not, perhaps bilateral project. Okay, there is a strong ecosystem, and 3 years, we have to remind that also. 3 years has been a very short period, in fact, to develop a so ambitious project. In the same time, we all know that China, India, the USA, we have many poles in the world that tend to develop much more fastly than Europe. And it was also reminded by Peter. When you see the investment, we need also some support. So the ESR, the higher education system, the research and education levels within our societies are part of the public policies, but we have a role to play with many interactions with the national level, the regional levels, etc. So it's very stimulating to be there, and indeed there is a room for development.
Yeah, it's very interesting, and if you have the time, we can come back to that, because the problems of health costs, we need some strategic thinking about how the increase in commercial and industrial interests is not a sort of has a boost effect on the health costs, and then so it's more of a. Can we transform this vicious cycle in a sort of a visual cycle? But that's another story. We'll go there if we have the time. So Zoltan, just taking this, and again, especially because you have this very privileged position as the Vice Rector for Scientific Affairs and Innovation at your University of Szeged. And it's interesting because we are in the extreme west, you are in the extreme east of our association. So what about thinking a bit on how to increase inclusion, diversity in research, education, and innovation at this global level? How can we, as Eric said, we have various things in common, but we are quite different. That sort of challenge, how can we transform it in an advantage, in fact?
Thank you very much. That was at least 5 questions. I mean, that in one. But let's go back to the original question. If we made any mistake before the pandemic, if I want to provocative, yes, a lot. But as a normal person, this is coming with the civilization. As the civilization goes just as a normal civilization, these things are coming. Every 100 years or something, this will be coming. And actually, the time between the two pandemic will be shortened. It definitely, we can see it now. What was actually interesting in the last couple of years that the world was able to change very, very, very fast compared to the normal times. This is for me as a chemist by education. I'm a chemist. It was very interesting for me because, you know, normally to make a vaccine, for example, 10 years or something. Now we were able to do it in half a year or so. This shows somehow that we would be able to make this kind of things. But when there is no pandemic, then we are not behaving like that. This is kind of strange things. I mean, that this is, everybody should think about this, why it happened actually. The other thing is that, as I said, I'm a chemist. For me, we are very proud that actually this new vaccine is coming from Professor Karikó Katalin's idea, and then we have new Nobel Prize winners from the last couple of weeks. So I mean, but actually the idea of the whole thing is a very, very simple thing. So I mean that if you just see it from scientific point of view, it's a very simple idea how to modify the RNAs to just behave like that. And it is a very simple idea. Of course, Professor Karikó worked a lot on that, but it shows us that actually we don't need to change too much in the field of science or education or so. Just we have to make the focus on this kind of thing. So it's kind of, so we put the focus now on the living people, and then it worked. It was a long time, but actually the question is that what to do if a new pandemic is coming. Just put your family to the car and go as far as possible, you know, from the center of the pandemic. But if you cannot do that, then you can see that we are able to move very fast. So I mean that I do believe that we learned a lot from the last couple of years. I mean that means that the humanity itself. On the other hand, we saw several. I was a bit surprised. Not big. I knew these figures about the innovation curves comparing Europe and the US and Japan and this kind, because I just as a vice rector I should know these figures. I was surprised why it came out right now, but because Europe is not really in a good position compared to the US, for example, and it's coming from the education, because you asked what about the education and research, and we are always saying, like Eric said, that we cannot really distinguish between education and research. It's going together. There is no education without research, and vice versa. But at least in Hungary, I know much better the Hungarian situation. We can see that we should change the educational system from the kindergarten, because this is why the US is far beyond everybody, because they are using an absolutely different educational method. I don't know if it is better or worse, but if you see the education theme, that definitely it's better. So they just start from the very early years telling their kids that you have to make something and you try to live from this one. You make new products, make new methods, whatever. What we are doing in Hungary, this is definitely just Hungarian, and everybody can tell their own country's educational system. We are trying to push as much information as we can into the heads, and then we'll see what happens when they are 20 years old. It's not working. All these things are in the books and on the internet, everything. So we should change the educational system for sure. And probably if we just start to teach our kids how to think and not what are the facts, then probably we could make even faster this kind of world-changing moments like now the vaccine or whatever else. Thanks.
But if you allow me, even to try to change the education environment or the way we do things, do you see it based even in the experience of some exchanges we had in this alliance? In this alliance, sorry, sorry. Do you see? Do you think that we need to put more emphasis or to make more efforts to increase the mobility of students around the universities, to have more people moving around and bring in their experience, their culture, their definitely. Can you all get more from that? Because if you allow me, things like the Erasmus are very interesting, but it remained to a certain extent a relatively limited experience in terms of the number of people involved and duration of that. So should we open or try to open our universities to an even higher percentage of let's call them foreign students?
Definitely. I mean that University of Szeged we have more than 25% now from abroad, the students. I mean, we definitely believe that you are much bigger and much better in quality if you have more and more students from abroad, wherever from. I mean, it's not really important from where. I mean, we have students from 130 countries. I didn't know that there are 130 countries together, you know, before. Definitely, we have to work a lot. This is what we discussed this morning with Eric, for example, that we have this EUGLO, we have the EUGLOHRIA. We worked a lot, as Joachim showed you in the morning, but we still believe, I think, together, but definitely I believe that we should still work a lot. How can we put this knowledge, put this thing to the level of the students, to the level of the persons? I mean, we have to move the students, we have to move the researchers just to go there, make research, make education together, and see the world. I mean, if you don't know how the world is working, you just know how is, like in our case in Hungary, then definitely you cannot do anything. I mean, that you just put a fence and then this is not working for sure.
When we summarize our discussion, we might say in the end that it seems to us that an increased mobility and an increased exchange of experiences and people would be a relevant outcome of this. So, Axel, I would like, taking advantage of your huge experience in leading networks of structures and research structures, and do you think how can we kind of forecast a role for an increased cooperation at that level, at technology level, just to design the future actions of EUGLOHRIA, both to face a new health crisis. Of course, it's our major concern here, but also to guarantee the continuity of a kind of baseline research that, in the end, is essential. It seems quite clear to me. If you want to be prepared to the acute challenges of things like a pandemic or other health crises.
Yeah, can everybody hear me? So this is always a bit of a pity, not being present in person. So I apologize for that. With regards to your question, Enrique, clearly the nice thing about the EUGLOHRIA network is already in the name is the fact that it's a network. So from interaction between different universities, we can profit a lot by exchanging best practices on how to deal with challenges, be it experimental and challenges on lack of knowledge and how to treat and how to diagnose future pandemics or future diseases. So this is clearly a benefit of a network that if many people work on similar topics, you have different approaches on how to address the topics and how to answer questions. And therefore, in the end, if everybody is open to share everything and is open to accept different strategies and then adapt the best strategy, the strategy on how to deal with all sort of problems will always be better. And I think in that regard, the EUGLOHRIA network can sort of act as prime example and maybe a blue pause of how to connect European universities even better. If I just kind of verge a little bit out of my expertise, I also think that the fact that in Europe, different countries acted slightly differently to the pandemic also allowed us maybe and hopefully to figure out of what is the best practice on how to deal with this. Is the complete lockdown better than how it was done in Sweden? You know, how do you do with school closings? And this has been a big experiment in a way on a publication level. But now that we have the results, and if we manage to look at them and then have a decision on what worked best and what was good for which kind of society, maybe allow us to act better on that. With regards to sharing of technology, the same thing is true. We need to exchange more. The big nice thing about EUGLOHRIA is that it really tries to incorporate many universities also from sort of not so research strong areas, which certainly increases something that I've just learned on a EMBO policy workshop last week, which is called absorptive capacity, which is something which is the ability of a local environment to understand and apply new informations and new technologies. And again, this absorptive capacity will then increase the local private sector, and you will have growth in industry. And of course, if you are within a network, the education, the access to information is much higher if you can share this among different universities. I think EUGLOHRIA is a network out of 9 universities. Clearly, in Europe, there are more than 9 universities, but we can actually learn and tell other universities on what we did wrong. And there, I agree with Sultan. There were several things that we did not do in a proper way, but also what we did right, and how we can profit and how we get better. Also in competition with other maybe more centralized areas like the US or China. I think there's a big benefit of the European community, and there is a big benefit of EUGLOHRIA as well.
It's very important, in my opinion, what you said, Axel. When I was asking Miguel about the importance of economic studies, and if we take, and now you brought the question of more behavioral things, what would be interesting, I don't know, it's a question, in your opinion, with all these infrastructures, wouldn't it be a real challenge for our association of universities to do something that we all know and we always say it's difficult, but it's probably the best way to do things, is bringing together different disciplines, molecular biology and behaviors, policy making, and immunology. You know, do you think we have can it be something to explore, in your opinion, for the future?
That's absolutely, I think that's the biggest benefit of EUGLOHRIA. I mean, we've discussed this on several other workshops, is that research-wise, the funding is just too little to sponsor any reasonable large research project, right? I mean, it's very nice to sponsor the networking and the interactions. The nice thing, and what I really appreciate the most of the network, is that it's so interdisciplinary. So this is something which is usually not done so much on research networks, because, you know, there are biochemists or natural scientists working together, and they already call this interdisciplinary because there is a physicist and a biochemist working together. But rarely there are economists or philosophers, as a matter of fact, to think about moral and behavior interacting with biochemists, right? And understanding maybe how protein networks are not so different in terms of their behavior from societies, right? So things like really crazy ideas we can toy with in such a very interdisciplinary network. So I appreciate this a lot, and that's again another power of the EUGLOHRIA network.
Yeah, I completely agree with you. Well, of course, all everyone in this panel can intervene, so I'm taking the lead, but please be free to increase the discussion. But to a certain extent, to cover all the participants in this round table session, I was thinking that, I'm bringing another aspect, if you allow me. We have this very large definition of global health. You know that sometimes, often, and in certain areas of health, global health is seen mainly as a kind of a modern name for what was earlier called international health, or it was many infectious diseases, in fact, some decades ago. So if I think it would be interesting to hear from Benedict as kind of a complement of his very interesting presentation on the global academia. You know, to develop this idea of global health or global public health, whatever you want to call it. What do you think about bringing into our alliance countries and experiences and students and even the networks we as individual universities have with people and with communities, with universities in different low and middle income countries. Could it be something as a new venue to explore?
Thank you very much for this question. This is rightly in line with when I give an example from the Global Academy. For example, we have seen this as a potential for moving forward. And so, for example, what we are now doing is that we are currently in the process of developing a global masters, which would now be a collaboration between the Global Academy, which now consists of all the different actors, institutions, networks, and also their networks, and then the universities within EUGLO. So for instance, for last couple of weeks, we had some representative from University of Porto who visited us here at Lund, and we've had discussions also with the University Central how this can be anchored. And in this way, what we are doing is that in establishing the global masters, we are bringing in the student perspective, but also using the networks and that we have within both EUGLO, but also our individual networks and institutions within a higher and a low income settings. So from EUGLO, we will have the European universities, including Lund University and Porto. And then currently we are also in discussions, for example, with some universities in South Africa, for instance, the University of Pretoria and Johannesburg, to use all this knowledge base to develop such a program. And in developing such a program, what we are doing is that we are continually developing capacity. And since these students would eventually be from different backgrounds, different perspectives, different cultures and systems, that would also lead to an exponentiation of or a rippling up of the effects that we expect. So one of the things that we also see as a benefit is that to have some sort of global institute. And for this, we've also been having discussions with our university here, Lund University, which is so very much interested in this innovative approach to now have an institution or a higher institution or global institution that will bring together all this innovation aspect, research, and then capacity development, which would also in a way make sure that the capacity that we have within all these different networks can be put to use. Because we, from our experience, and also as you may agree, that involvement of the different stakeholders right from the beginning of the process is very much important if we need to think about sustainability in the end. And that's what we see as a big strength if we are to move ahead with these ideas, that initially we have to include all the different stakeholders and networks to build up the idea, not to rather cook the idea from our side at Lund University, for example, and then when it is finally cooked and the meal is ready, we invite others to eat. We don't really believe in such an approach. So we believe in building the ideas together, and then we expect that it would have a bigger impact in the end in terms of global health and interventions and actions.
Thank you, Benedict. I'd like to ask Eric if he thinks that this might be in line with what you said about trying experiences and taking advantage of the rich experience you already have among us. And this could be, for instance, this a proposal of a master program in global public health, whatever you want to call it, that has been discussed between them and people here from Porto. Could be something could increase, let's say, the surface of connection, the borders of the alliance to other countries and so on.
Okay, thank you for the question. Indeed, I think that the initiative that was presented by Benedict is fully between to be identified for sure at the level of the European Commission, etc., at the European level, but also we have a role to play externally with respect to different regions of the world, in Africa for sure, South America, etc. And there are, Asia for sure. And to some extent, the initiative launched by the Commission, so the European Alliance, is scrutinized, is observed, at least is observed by the different regions of the world. So in line with the topics discussed presented by Benedict, of course, we have a role to play, and mostly probably that new trainings, like the master that you described, seems to be under discussion between different partners, is something that will be part of what we will do with respect to the international regions, because I think that we would welcome candidates from the different regions, or some projects may be achieved in connection with problematic topics, hot topics of the addressed regions, in terms of either public policies or basic research. Everything is part of that story. And also a new and very important, not new, but a very important dimension is the fact that the research activities will have to be co-hosted and supported by both parts. I mean that we will not provide a service to the countries of the universities of Africa, South America, but we would have to develop jointly research projects in a balanced relationships between them and us. And we know that, for example, within the Alliance, different countries have many relationships with the different regions in the world. For sure, Portugal with Brazil, France with many countries in Africa, Spain with many countries in South America, etc. So definitely. And so that master initiative would be part of the reply, probably. Thank you.
We have not much time left, and I would like to go to Joachim for at least the final reflections. But I think it might be interesting to have some questions from the audience or people following us at internet. anyone wants to add some comment or make some question or share some experience? Not yet for the time being, so probably you are quite clear and everything is interesting and challenging. Before going to Joachim, I would like to remember that, and sure you also remember it, but during this morning, Peter Hartmann showed 2 or 3 very relevant slides. Some were already commented here. The distance between the investment that the trends in investment in the US compared to or China clearly increasing, that reached the European investment, that it's quite lower than what we see in the US. The other one was the worldwide increase in the expenses with the health, the per capita expenses with health. And then, if you remember, Peter brought 2 areas that might add to a solution, and so he brought 2 areas that might be 2 areas of our interest for a focused strategic approach. And one, you remember for sure, was digitalization, and the other one was prevention. Allow me to add a third one that I think it's quite relevant if you want to guarantee the sustainability of our health system, at least as we see it in our countries. That is health promotion, because if we don't promote health, if we don't increase the health capital of us as individuals and us as societies, we will face more difficulties when we have to deal with the threats of disease and the health crisis and so on. So I don't know if you want to comment on opportunities for that now we have as an association of universities in both these areas, digitalization and prevention / health promotion. Okay, so now we have a comment from the audience, and I don't know if somebody from among you want to then add something.
Yeah, I can try. It's a very good question, yes. The question is, if you don't have that support from the private sector, maybe we won't have the opportunity to innovate. So as a global, we become worse. If we can share, if we have the certain rights put in place, I believe it's possible to have the support of the private sector. Being dependent in terms of development of global health, I believe we are on the same route. The question will be, who will benefit from those innovations? We can benefit, we can monetize those innovations. In the end, if you are research, if you are innovate for new products, new vaccines, new way to tackle digitalization, someone maybe in the future will profit. We expect to be the public and not the private ones. But with the right contract, it will be shared. Obviously, if we want and we need the private sector to develop these ideas, we need to be prepared to share with them some of the profits that will come. There is no way. It will be worse if they can expropriate all the benefits of that technology, but then we need to take care of that. But I believe we cannot move without them. And we cannot expect them to interact with us if we don't have nothing to offer to them. And so they were not doing for charity, for sure. Let's be honest. It will be very, very beautiful to have the companies just support the research just for the well-being of humanity. That won't happen. Let's be clear, but we need to develop those innovations, solutions for tackle global health, and we need them. We need their support. They need their knowledge, and that's one of good thing of EUGLOHRIA. We can make a better value proposal to them because as a group of 9, we are much more important than one single university. And so maybe in the negotiation, we can have some. Because we have more to offer, we can get more from, but we need to share with them the benefits of the innovation. There is no other way.
I have a question and a remark and a question for the colleagues also, etc., for the experts. In terms of digitalization, we know that in Europe, we do not own the main companies. So the main companies in terms of data digitalization, the main companies in hosting the clouds, the super clouds, etc., are in the hands of our regions of the world, especially the USA. So in terms of independence, in terms of even sovereignty of the health data that we may have, etc., I've heard Peter Hartmann from Lund University this morning telling us that everything could be held by digitalization, etc. He is the expert most probably, but what about probably that EUGLO alone cannot solve that, okay, for sure. But this is okay. This is a question. Maybe we can have the feedback of any expert in the room or any colleague, any people, okay.
Thank you. I would just this digitalization and all these things. Most of the time we forgot. I think one thing that the innovation is the public mainly thinks that it is the wheel and the engine, but we always forget that at least half of the innovation is coming from social science. We learned in the last couple of years that we have to work a lot on society. We have to make new innovations on the society, how the people behaves in the beginning of the pandemic, the middle and the end, and the now actually. So in Hungary, in the University of Szeged, I am always trying to push the people not to forget about social science, humanities, and all these things, because these are probably even more important than natural science, although I'm a chemist. And digitalization is a very important thing. This is a kind of political and financial question that who is the owner. Actually, this is very important. If you have big data, you are working. Most of the people are now working with big data, and if you store the big data in a Google Drive or whatever, then you have to read the small letters always, because it's not easy. So for example, we are building an artificial intelligence center just for the University of Szeged, because we know that we have to somehow put University of Szeged on the map of MI as well, but again, and Axel already said something like that. Actually, I think for me, the main point of the EUGLOHRIA was to put together this white book, but on the other hand, the interdisciplinarity, and not on the point like Axel also mentioned, that physics and chemistry or biology or whatever, but the social science together with natural sciences and medical sciences. This is a very important point of the whole EUGLOHRIA and the EUGLO. The EUGLO was made of working together for 5 universities, not for COVID, but we were in the middle of the COVID when we started. So it was a very easy decision, let's say, to jump on COVID. But this is not made for COVID, but so now somehow at the end, or hopefully at the end of the COVID, we have to figure out what to do next, let's say, and then we should focus on this kind of interdisciplinary. I'm pretty sure. Thank you.
Well, I think we are quite close to the end of our time. It's interesting because I think we need to also reflect on that. It was, to a certain extent, it was good for EUGLO that COVID happened, because then we had a real global threat, and it's very easy relatively easy to come to some sort of consensus when you face such a huge threat. But the real challenges are now for the future, because now we need to have strategic thinking. We need to come together to define common goals and all that. And I think it's interesting that the question that was brought here, because patents is one of things that we are always told to look for, to raise money for our universities and so on. And in health, it's from an ethical perspective, it's a very challenging topic. And there is for those of you, if you want, there is a relatively recent book called Owning the Sun. It's about monopoly in medicine and patents from aspirin to COVID-19. So if you want to reflect on that, it's a nice book. So a final question, then we go to Joachim to close. If you to respect, I mean, we can stay here if you want. If you allow me, I would send your questions through the internet to Joachim, because I think he reflects a lot on that type of things. And allow me just to say a word of gratitude, because Joachim was an extraordinary leader of this work package, and he helped a lot to move forward with the EUGLOHRIA project. Thank you, Joachim. So the floor is yours now.
So much, Rick, and I would like to start by just thanking the entire roundtable panel for all your thoughts and sharing your insightful thinking on these very, very difficult but important questions. And particularly thank you to you, Enrique, for fantastic moderation of this session. It's always a little bit tricky when you have some people participating digitally and some being in real life. So thank you very much. So I know that all of you are probably quite hungry now, and we're a little bit overdue already, so I'm not going to be long. Just sharing a couple of reflections from my side. So in terms of lessons learned from the pandemic, or errors, as you said, Enrique, for me, I think the main lesson is well, on the one hand, it's true that we did come together quite swiftly, if you consider where we were at when the pandemic started. At the same time, I think most evaluations that at least I have read now being put forward more and more is that we still acted a lot in silence, and we didn't really have the means to very swiftly act together and work together towards a bigger common goal, if you like. And there's many examples of those. So I can just bring up one Swedish example, for instance, with regards to the elderly part of the population. We knew very, very early during the pandemic that the elderly part of the population was the most vulnerable. Still, we were not able to put in place routines, rules, restrictions to actually safeguard and protect the elderly part of the population in Sweden, and also not in many other countries. And we also went about the recommendations very differently. Sweden were one of the extremes, but then on the other hand, we had countries where people were locked up in their houses and basically everything in between. And the point that I want to make here is I really, really can't see any other part of the society being better fit to serve as kind of hub for knowledge transfer and capacity building as universities, and even better university alliances. So I can really see a large role for this type of alliances like EUGLOHRIA. There are other alliances also within Europe serving as that. And so that's what I would like to emphasize and put focus on. And when we talk to politicians and also to European Commissions on why this is so important. And from our perspective, what we have done is that we have been, in a very short time, very successful in creating a framework on how to identify critical mass of researchers, students, co-workers at universities that could work together on different questions. And as you rightfully mentioned, Enrique, naturally, most of those collaborations came from the medical faculties. But in fact, when we look at the pilot projects that we have now, and also some of the seeding grant projects, there are also examples of people from working on law, for instance, or other faculties coming together to address important questions related to pandemics, related questions. So I think we are very, very fit to take on that as a university alliance. And then I agree also with what Eric said, that an important part of making this stronger would be to build on our younger and younger part of our research community, young talented PIs and researchers that could drive this work. And I also wanted to just reflect a little bit on, I think it was Axel who mentioned that we are now 9 universities in this alliance, but of course, if you look at Europe as a whole, there are many, many, many more universities, right? And I agree, but on the other hand, what we are really good at universities is to collaborate. So if we were to map out the networks that each single researcher have access to, there would be many, many more universities than the 9. And that would even go beyond Europe. So again, coming back to us working as a hub for creating those networks is something that we can do, I think, in the future. Finally, what we need to do, and that's something that Eric is pivotal in driving as well, is to find sustainable solutions where we can have core people working on those frameworks that we have generated here and developing them further and moving towards a EUGLOHRIA 2.0. So I'm going to stop there. And again, thank you very much for all comments and the attention.
Thank you, Joachim. So I think we are over schedule. So allow me to propose to close this very interesting, challenging, and I'd say inspiring morning. I just please allow me again also to deeply thank the people from the international department work with the EUGLOHRIA that has prepared everything as usual so well and so nicely. So thank you very much for your work. And I think let's have lunch. It's time for that now. And bye-bye to all of you in your institutions that joined us through the internet today, and the people that follow us live in the internet. So good afternoon.
Thank you very much. Before leaving, we are just wanting to do some. Excuse me. English? No. Just before leaving, we are just wanting to invite you all. This is the end of the workshop for the morning. On the afternoon, we have a conference on the transnational perspectives in sharing infrastructures in global health. So join us here and at home at around 2:30 local time. And we have lunch outside the auditorium. So thank you very much.